Pulmonary rehab is what most people would think of an equivalent to cardiac rehab, but for lung disease. It actually encompasses cardiac rehab though, in the sense that you're exercising people and you're exercising them to a percentage of their target heart rate, but it's dependent on what's their underlying lung pathology that influences that. In cardiac rehab, patients have less other comorbidities, so they may not have liver disease or lung disease. It may be that they've had a MI and therefore they undergo cardiac rehab to exercise train for that. With pulmonary rehab, you have patients who have a gamut of disease processes, from COPD, emphysema, to asthma that's being very difficult to control or refractory to some of the invasive treatments even, cystic fibrosis in kids or young adults, to pulmonary hypertension and interstitial lung disease, or even neuromuscular disease. And they're trained all differently depending on that pathology. We meet, meaning myself and the rehab coordinators, and we meet with the patient. We come up with an actual individualized plan. It takes about 4 hours of evaluation for them, where they do a variety of questionnaires, exercise evaluation, including weight training, and then we come up with an individual plan for them, and the class lasts 8 weeks. They come 2 to 3 times per week, and part of the structure of this is they actually get education. So they don't just come in and work out like they're going to a gym. They come in, they get education on medications, education on nutrition, palliative care. The actual exercise therapy is done by our respiratory therapists that are specialized in pulmonary rehab. We're blessed that we have one that is an actual master's prepared exercise physiology level. And so they're very skilled at all of those techniques. And we have yoga even, we bring yoga teachers in. So we have a pretty good expertise in that. The program itself, in terms of what kind of exercises and to the extent that they can go, is designed by me. Based on how they do at the beginning part on the screening, I can determine whether or not how much they're going to be able to lift, for how long, what their work capacity is, etc. Often some of these folks have not thought about how do they want to spend the last part of their life. So we do a lot of pre-transplant evaluations. Some people prior to having surgery for cancer. And this is maybe the first time they're actually directly talked to about, how do you see yourself dying? How do you see yourself getting your financial things together? What kind of support do you have at home? And then we help to make those things happen. We've hooked them up with community resources, social workers, pastoral services, and done advanced directives for them so that they can get their own individual needs met. So it can be a very emotionally laden conversation, and we have some very skilled people that do a great job. I think what's publicized mostly is that it's an exercise program, but it's really an all-person program.